Let us discuss this commonly asked topic, the early sonographical features of pregnancy. Like, this is one of the most frequently asked question, at which particular sign is seen at what gestational age, cardiac activity is seen at what gestational age, a G-sac appears, what is the first radiological sign. So mostly we do TVS or transvaginal sonography for appreciating the different sonological findings, but a trans-abdominal sonography, the standard sonography, can also be performed with a lesser resolution and a delayed detection of the features. So the first sonological sign to appear is a small anechoic fluid collection within the endometrial cavity. Like, suppose this is the endometrial cavity and here is a small anechogenic collection of fluid, and this is called a gestational sac or a G-sac, which is typically appreciated in a TVS by 4th to 5th weeks of gestation. And after about a few days, like mid of fifth week, within this gestational sac appears a brightly echogenic ring with anechoic center. A brightly echogenic ring with an anechoic center, which is yolk sac, which is kind of confirmatory of an intrauterine pregnancy. Because what happens with a G-sac is, when a G-sac is formed, it's an anechoic fluid collection within the endometrial cavity. Sometimes what happens is a pregnancy can come formed within a tube called known as ectopic pregnancy. Of course, you know. When ectopic pregnancy happens, there can be a fluid collection in the endometrial cavity as well, and this is known as a pseudo G-sac, and needs to be further evaluated when seen. Along with G-sac, there are two more features I would like to highlight. One is interdecidual sign, which appears at the same time, which is one concentric echogenic ring around the gestational sac, and if there is two concentric rings around the gestational sac, no brainer, it's called a double decidual sign. So these all three are seen in 4 to 5 weeks on TVS, and by 5th week mid, what we can see is a yolk sac, which is confirmatory of an intrauterine pregnancy. Let's just call it 5 to 6 weeks for simplification. At the end of sixth week, what will appear is, within the gestational sac, beside the yolk sac, one fetal pole will appear, one brightly echogenic streak will appear, that is called a fetal pole. And within the fetal pole, you can appreciate the cardiac activity, the fetal heart beating, cardiac activity by the end of 6 weeks with an TVS. So we have spoken about TAS. TAS is slightly less sensitive and it detects the fetal findings a bit later. So TAS, it will be 1 week later. You can take it as 1 week later. So 5 to 6 weeks, we can see the G-sac, the double decidual sign or the interdecidual sign. By 6 to 7 weeks, we can appreciate the yolk sac, and by 8th week on a transabdominal ultrasound, a TAS cardiac activity should be seen. Thank you.